All right. Good afternoon. I'm Rich Haddad. I am lead the K21 Health Foundation in Kosciuszko County. It's actually an independent private foundation. Our mission is focused on impacting and improving the health of every resident in Kosciuszko County. So a pretty broad mission that we focus on. And I've had the opportunity to join the committee with the health department to try to figure out, strategize, and deploy the Health First Indiana funds for our county. So I've really enjoyed engaging in local government in that way and moving, I think, our community forward with the blessing of these funds to impact our residents. So it really aligns with what we do. And so you talk about collaboration and partnership. There's a lot happening because we now have a partner, frankly, which is wonderful.
I'm Kellie Streeter. I am the president of the Knox County Board of Commissioners, as well as currently serving as president for the Indiana County Commissioners. I also wear a little bit of a different hat. I am the full-time administrator for the Daviess County Health Department, which is a county just adjacent to Knox.
Hello, my name is Stephanie Laws. I am a vice president for the Union Health System there in West Central Indiana. And I administer our critical access hospital, which is in Clinton, Indiana. I also have the pleasure of serving as the board chair for our Parke County Health Department. And so the collaboration between the Hospital Association and the healthcare sector and the Public Health Department really does resonate, and so we're very excited about these funds, and I think you'll be interested to learn on what we've done in this very short period of time. So thank you for having us.
So excellent, great segue to my next question. So all three of your counties opted into funding in 2024, and so you received the funding just in January of this year. So my team and I are on our 92 county tour. We just visited number 68 yesterday, and we have been really humbled and blown away by, honestly, a lot of the good work that has already started. So all the counties are at a different spot, right? But we have found, especially in some of our rural communities, that they knew what needed to get done, right? And they've already said, okay, we're going to start implementing some programs that we know we've needed for years and years. So Stephanie, why don't we start with you? Can you share some examples of things that have already been initiated, implemented, or strengthened? So things that were happening, but that you strengthened thanks to HFI.
Of course, thank you. So as many of you know, regardless of your role, there is a lot of dialogue around the inflation of healthcare prices and also along the health and wellness of our Hoosiers. More chronic diseases, a lot of just bad health, for lack of better words. We do have a high smoking rate. But what we did, and I'm going to call out a couple of my colleagues here in the crowd, we worked with our local Chamber of Commerce and Heather Thompson, and then also partnership Parke County with Cindy Todd, to get in line with our local businesses, our organization, and our rural employers to go out and do free health screens. Those health screens help us to identify problems early on and to provide access and linkages to care. Why is that important? A lot of our rural businesses, organizations, employers, if insurance is offered, it's often high deductible or catastrophic. If that employee does have one of those later stage illnesses that is undetected, that's going to cause a lot of lost work. It's going to cause a lot of inflationary cost and medical debt burden for that family. And so we're really trying to work to help identify those conditions early on. We also hope that the benefit to those rural employers is that there is a recruitment and retention value, meaning that those rural employers who didn't have these resources before know that they're cared for, the employees can come to work, we know that there's resources, and we have somebody that we can call to access the necessary information and the linkages to the health care that they really do need. We understand that when you are working in a job where you're making ends meet, we know that the cost of living has been on the increase for some time now. Health is often deprioritized. And so with the modifiable risk factors, as I said, you know, the obesity that Dr. Weaver just mentioned, looking at Parke County in that really dark purple, looking at, you know, our primary causes of death, it all comes to a very cataclysmic end for a lot of our citizens much too young. And so we're helping to impact that.
Well, I'm going to highlight Knox County first because all of these counties were so drastically different, and this is how this money was derived in the beginning. We're all different. We all have our own issues. We need to make our own plans. So in Knox County, we knew what those issues were. We knew we were have extreme obese issues. We have some chronic disease problems. Our children need to also be addressed with obesity. So we looked at this investment that our legislature made as a generational focus. How do we look ahead 10 years and we have solid data from these numbers? So we have partnered with all of our schools very strongly, our community mental health center, and as well as our county hospital to start programs in our schools from fit kids to nutrition. We've also started community outreach, partnered with our hospital to just make sure people follow up on their medications. That's a lot of the problem we found. People will get their medicine and then don't take it or don't get the refills. So we are doing much community outreach programs. We also have many clinics, free to men, free to women, all based around really maintaining a healthy lifestyle, and it's all free. Again, thanks to this great investment in our community. Just east across the river in Davies County, we have a completely different population. We have a very large Amish population, and we have a very large immigrant population of Haitians and Hispanics. So we have a whole different set of issues and challenges. We have the lowest vaccination rates, well, the second lowest now, it used to be the lowest, in Indiana. And a lot of that purely is because our population will not receive it. Now, they will one here and one there, but we are actively going out in the community on a regular basis to teach that this is for protection for the children. This isn't, we're not forcing things upon you, but we're building relationships. So we have hired community health workers, and we are in our community face-to-face building relationships with every community and rural program, from First Choice Solutions that helps pregnant women all the way to our hospital. We know we have a major disconnect in our community with the people at the health department, and we're looking to fix that. And one of our greatest issues there is infant mortality. So we have found through the data we've been received, most of these women don't receive prenatal care. Most of them don't have insurance. So we have started a pregnancy clinic. We've hired a nurse practitioner, and we have a pregnancy clinic every Monday where if you're uninsured, you come in and we take care of that woman and that child to birth, and we do some follow-up after. And on Tuesday and Thursdays, if you're uninsured, we also see individuals for a cough all the way to a physical. So just really building relationships and partnering. It's been incredible.
I think, to me, I always describe people, I think that's the brilliance of this legislation, how the funding has rolled out, is that just two counties that are right next to each other, really vastly different needs and at different spaces in these areas, and that you guys have now been able to do what you needed to do to address those concerns. But like we said, every county is different, and it is really relying on partnerships. So Rich, if you want to speak a little bit about what's it look like in Kosciuszko and really kind of highlight where the partnerships are going to come into play as you guys are still kind of in the space of building your plan.
Yeah, one of the things I think the committee and the health department realized is that they weren't equipped to deploy this funding quickly because they didn't have the infrastructure. And so one of the I think really wise things is to go and hire what they would say is Health First Indiana coordinator or director. And we were blessed with an amazing leader who was retired recently and board. And so Kurt Carlson, who led the Bowen Center, one of the largest mental health organizations, nonprofit organizations in the state of Indiana, had been a couple years out of turning over the reins, and he literally came back and went, is this something that would help our county? And we're like, yes, get in there. And so that's been a big help, obviously supporting his position inside now the health department, a really important investment of infrastructure building. But I think a couple of the partnerships, again, that we've seen, we actually have a nonprofit that we helped kind of launch a couple years ago focused on public health called Live Well Kosciuszko. And they're doing a lot of great things. And one of their roles is to head up our local tobacco-free coalition. And again, the needs in every community to really make inroads, not only on tobacco use, but the rise of vaping use, especially in our youth, is something that really needs a lot of attention and investment priority. And so one of the early decisions of the committee in the health department was to support expanding the tobacco-free effort. They call it Breathe Well, is their organization under Live Well that focuses on tobacco and reducing vaping and education. So they are extending a tobacco and vaping public campaign, social media, billboards, and other media use to try to address this issue. The funding is helping extend and expand that campaign, along with being able to program and educate deeper into our school systems. So they're down into the late elementary ages now, talking about vaping, talking about those dangers, as well as all the way through, really from late elementary through the high school now, which is really important area as well. I think the other thing that really collaboratively is happening is, and I know you mentioned Marshall County with their mobile, is Kosciuszko is one of the 3 largest geographic counties. And again, we're centralized, Warsaw, Winona Lake, which means all the services are in primarily Warsaw, Winona Lake, right? And so the inability for people to have access to food that are food insecure and health care is really a problem for us, with a lot of towns and a lot of our residents really outside that central part. And so both the food mobile solution and a health clinic mobile solution is really in development. And I think what this funding has done is opened our eyes, and the planning and figuring those big ideas out has brought a lot of different parties together to figure that out. So Live Well and Purdue Extension and our local food pantry and the health department, and it's really great to see that collaborative planning happening.
Yes, excellent. So really great things going on. It made me think, actually, when I was in Parke County, one of the commissioners shared that this was the first time he had really felt hope for the future of Parke County, and something that they discovered, I mean, not even really associated with the funding, but just because it was there and they had this possibility, was identifying partners that were already in the community but were not connected to one another. So can you speak to what partnerships have looked like for you all?
Yes, and I would say, going back to Governor Holcomb and talking about the team, I would say really that for the first time in the history of the health department, that we were able to bring together the commissioners and the council to a very collegial level around a common mission and a cause, and that be for the health and well-being of the citizens of Parke County. It has just been a tremendous effort on, not only when we talk about partners, you start with your local government officials. And it has just, like you said, it's been tremendous. But the partnership, and you alluded to that so clearly, that we are right now a team of 1.5 employees in the Parke County Health Department. I am the board chairman, but I am also doing a lot of operational lift just because it's needed to get this funding off the ground, and I mean, it takes a village. But we started a Health First Parke County initiative, and we meet the first Tuesday of every month. We do it electronically because we know people have lives, but they also want to prioritize their neighbors and the health and the mission of this initiative. But as previously stated, we've got partners like Purdue Extension. We're also working with Thrive West Central. Our intention for the 2025 funding is to have a rural transportation hub where we have a dedicated route plus a requested route for our citizens. And not only will it be running routes for people to get to their appointments, to their essential services, it'll also be a food bus to take out essential food boxes and other types of goods to individuals who don't have transportation needs. The social determinants of health, not only in rural communities, but also urban communities, is just extremely profound. So therefore, we brought in our Parke County ambulance service, and we're running a mobile integrated health cause through their efforts, because a lot of times when people get to that dire strait, they call 911. And when they call 911, they come, whistles blowing, all to find that there's no heating source, there's no water source, there's no food source. There's just not a lot of social support to be able to keep this person safely and effectively in their homes. And so through this initiative, we're hopeful to take information, prevention, resources, and tools out to these residents and thereby help, again, I'll go back to healthcare cost reduction, of taking them to our local emergency department, really for issues that we can solve at home through our partnerships. You know, I mentioned the Chamber of Commerce, I mentioned partnership Parke County, we have the school districts, you know, businesses, employers, we have local physicians' offices, because there is a piece of this puzzle that every single person has a role and a part in to ensure that we're working in the same direction. And this funding has just lit that on fire. It has stimulated the conversations and the enthusiasm. And it just, like Commissioner Mee said, you know, now when you open the paper that comes out weekly in Parke County, you see just a lot of life in the health department and what's happening in the community. So we're really excited about that.
I know there's some county executives in the room here, I see, but as a county executive, from my perspective, the rollout for the first 6 months of this year has been really interesting to see over the state. You know, Dr. Weaver gave story after story after story, and there's 100 more where those have came from. Many of our health departments were aware of the need, but truly didn't have the funding to implement the real programs grassroots, and we're seeing that. Very thankful to be a part of that. County executives were building relationships with their health departments that I'd never seen or heard before. Our county councils as well, because they have to be a part of that process. So the relationship building internally in local government has been very encouraging for myself, as well as many commissioners I talk to regularly. And the other thing I want to point out, it's just not building relationships with our private partners, our hospitals. This money was never intended, in our perspective as executives, to make our health departments bigger. It was to provide services by partnering, and counties are already partnering. For instance, I'm partnering now, Knox and Davies, hopefully in the near future, for some environmental added reviews we have to do for eyelash and tattoo and some other vector control things. We don't want to hire a full-time person when we can share. But tuberculosis, I'm not from the healthcare background. I'm a manager of other things by trade, but I learned in the last 2 years, in just Davies County alone, tuberculosis rates are up 16.4%. Well, TB is everywhere, and we have to get a handle on it. So Davies County has partnered other health departments, Pike, Gibson, I can keep naming, I think we're up to 6 now. So we're really not growing ourselves in a way I think a lot of people thought we would. We're communicating in our districts, and we're really growing appropriately to make sure we're spending that money efficiently, and that's what I've been witnessing.
Yeah, I think we have seen all of these, maybe expected if we would have looked back and really asked ourselves these questions, but surprising things. I mean, really communities diving into transportation, counties working together to say, hey, we're 3 rural communities. Do we all need our own tuberculosis nurse, right? Why don't we hire one person that can serve all the communities? As I go around, we've never had a tobacco coalition, but we found out the county next door is doing a great job at it. So we're just going to jump on board and do what they're doing, right? They're going to train us to a train the trainer so we know know how to go out in the community and provide this education. Part of what's happening that, and I didn't talk about it in my presentation, and maybe you guys have something to add here, is that we've really changed how we're doing public health from the state side as well. Health First Indiana is not just an investment and funding going to the local health departments. It's really a change in how we're going to do public health. It is putting health first. And part of that is we now see ourselves at the state as our role is to make sure that our local health departments have everything they need to be successful, and our local communities by connection. And so now we have 3 regional teams, North, Central, and South. These teams live in these communities. They understand the needs of those communities, and they are available at the drop of a hat, a phone call, a text message, or whatever, to make sure that the local health departments, the local communities have resources, have what they need. They're connected to the subject matter experts at the State Department of Health, that they're aware of evidence-based programming, but they're also helping the counties connect to each other for the first time, really, that I've seen in my career in public health at a much higher level, right? So if they're like, hey, we want to do this program, we want to do a walking program, and we're way down in Parke County. Well, actually, White's already started this program. Let us connect you to them. Or we want to do a mobile integrated health. Oh, we know somebody, let us connect you to them. Or did you know your neighboring county is already doing this? Is there an opportunity for collaboration there? So I didn't know if you guys, I mean, I know you are probably acutely aware of our regional teams, what they're serving, but would love for you guys to add something to that.
Yeah, I'd love to comment on, and you mentioned it in your presentation, don't want to backpack you too much in your team, but the reality of our health department is really to try to make sure the core services that are required of them are happening in the county. And so it was a literal game changer, right? We're in Hinkle. It changed everything, and they were like, oh my, like this isn't space, at least in our experience, the health department had ever gone or ever had to go. And so one of the things I think you and your team have helped us is to frame out what areas of health there are, the KPIs, the major areas. And again, it's like you didn't require or demand that of each county, each local health department, but here it is. What does your county need? Where do you go first? What's your prioritization? But we now have a framework in which to operate versus this is so overwhelming, I'm paralyzed, I don't know where to start. You know what I'm saying? And I think then the data-driven and the ability to report, again, for me, that I love that. Maybe some bristle at that sort of interaction, but to me, it allows us not only to plan, but to progress, but to move and to see how we're doing. Again, you've built a lot of that structure out that I think locally we get to benefit from. So I think that's all positive, and we'll see a lot of benefits from that, but it really helped frame things out. The other resources you've provided, regional help, I referenced Kurt coming on as our Health First Indiana administrator or coordinator. Guess where he turned immediately to try to get up to speed? Like, we all knew this was coming last year, right, in 23. He didn't come on board till early 24, and he's like, where do I start? Well, he started with a lot of the staff and resources you had already built so that he could start figuring things out and helping lead us towards the right strategy for Kosciuszko.
Well, as a county executive, I'm pleased to report that we also truly have the county decision-making process throughout all of this, and the State Department of Health has been an asset in support. I know there was a lot of fear amongst many communities that it would be a state-led, driven decision-making process. It was amongst commissioners, but it has not been that way at all. The team has been an incredible support system for many of those small, super small counties that had 1-2 people in their office that really didn't know where to start and were feeling as if, how can I get all of this done? When really, they've had this amount of time to start telling their story, and as long as they're putting that plan together, you know, the expectations of us, we can't change health like this. The expectations of us were to look at these services, look at your community, derive a plan, and start somewhere. And that's what we've been doing, and being able to call upon many members of the district staff from the financials to the core service analysts. I appreciate the support. It's been great and very relieving as the county executive to know, this wasn't a built-in structure of you have to do it this way, and it's gonna turn out incredible.
Yeah, I would say from Parke County's perspective, this has just been a tremendous experience, and especially working, and I'll give a shout out to our Central Region team. But from a state's perspective, anytime you have a large investment, and especially into health, we need to look at that return on investment to keep those funding streams just lively and going. And while it wasn't prescriptive at the county level about what we need to do, the measurements of how we're doing it and how many lives we're touching is something that is standardized across each county at the state level, so that we're giving all of our playbook and our impact back to the state to be able to look at that return on investment. We're not going to be able to change Hoosier's health in 1 year, not 2 years, because it's very translational across generations. However, the impact of measurement, I think even coming out of this first year, is going to be tremendous. And then again in 2025, because we have just got our county budgets and submitted our 2025 request. This is going to accelerate our ability to remain independent as counties, but also have a centralized or common cause around similar data, similar measurements, be able to have the independence to have the walking program, or maybe the chronic disease clinics with the local employers, or the mobile integrated health. Again, counties are different, but feeding that up into the impact will help secure funding moving forward. So really like the support that we're getting there.
Yeah, and I think it's everything is feeding up into that bigger number, right? So we do have our state level key performance indicators are out right now. You can find them on the healthfirstindiana.in.gov website. They are going to change at the end of the year to really be metric focused, health outcome focused, recognizing it's going to take several years to move those big numbers. And our local health departments will have their own key performance indicators by the end of the year. And that's going to look different. So everyone's like, if everyone's doing something different, how are you going to move the needle? And my easiest example is to say infant mortality, right? We need to keep driving down our infant mortality rate. We're at 6.5 in 2023. We want to get down to the healthy people goal of 5.0. And okay, so every local community is doing their own thing in that space. And when I respond is, yes, that's correct. Because in one county, what's driving the infant mortality is substance use in the moms, right? In another community, it might be asphyxiation by unsafe sleep because they maybe don't have a crib or a pack and play to put the baby in, or there's some education opportunities there, right? And so that's going to look different in that community. And their KPIs are going to be focused on that, right? On how are we connecting moms who have substance disorder? How are we connecting them to services? Might be a KPI in one of the communities, and it'll look different in other. But it's all feeding up under those big health outcome metrics where we're going to drive the needle. I'm actually super hopeful that I think that we're going to actually start seeing some changes here in the next couple of years, especially in some of our rural communities as we begin to implement and make these changes. Something else I want to make sure that we have time to talk about that has come out of this, in addition to the many other things we've talked about, is businesses. And you talked about how you guys are actually working with the businesses. In general, people are not doing preventative care anymore. We're seeing people show up to hospitals with their end-stage kidney disease, with their stroke from their undiagnosed hypertension, with their undiagnosed diabetes, right? We don't see people really taking the time to do their colonoscopy screenings. We know some of our health departments are looking to even help with making sure people are getting their mammograms, colon cancer screenings, et cetera. So can you guys speak to about how do you see this benefiting the economy? We've also heard about, our economic development friends saying health is part of the conversation when we're trying to recruit a new business to our community. So tell me about, are you hopeful? Do you see this as well? Or how have you seen this conversation happen locally?
Yeah, so we talk about the collaboration of the healthcare sector and the hospital system along with the public health. When we look at those healthcare costs, and there's a lot of buzzwords out in the news on how inflationary those costs can get, and anybody who's been a patient recently or within the last 5 years who've received a medical claim knows how costly that is. And a lot of Hoosiers don't have that extra liquidity laying around just to be able to write a check to their medical care, and so it becomes on second base. We don't want to, prioritize that to get the colonoscopies or the mammograms and things like that. But to be able to do these preventative pieces, to address what we're calling social determinants of health, do they have all of the essential services to remain safe and healthy in their home environments? Can they earn a living wage? Can they get to and from work? Can they get to resources, their medications? We're trying to address those matters because what we're finding, at least in our community, is there's a lot of barriers that need to be coming over the top to help them lead their best lives. But we're also seeing this more in our pediatric population as well. A lot of well water, not fluoridated, dental issues. We have a lot of it's cheaper to eat unhealthy than it is to eat healthy and to access those fresh fruits and vegetables. So we have a generational issue that we're going to be facing even more in the next 10 to 20 years, I would say. But when those patients come back to the hospital, we have quality measures from the hospital that says readmissions are a no-go, right? We're not supposed to readmit patients unless it's absolutely necessary. But that patient may not have heat, they may not have cooling, they may not have their oxygen equipment at home that's functioning, they may not have the things, or they may have let it go so long that there's no way possible to avoid the admission. But what we know is that's costly. And so our mission is to try to give these residents of rural Parke County every single resource that we can to help them be successful and to decrease that burden of medical debt. And along with the businesses, the employers, and the organizations that we're working with, again, it is a hard day to recruit. Whether you're in the hospital, whether you're at one of the fast food restaurants, whether you're at the local markets, it's hard to find workforce. It's hard to find dependable workforce. It's hard to find workforce that will come into work and not call in sick, or because they didn't have their diabetic medication, they didn't have their insulin, they didn't have, whatever resources that they need. We're hoping that bolsters that stability with our local employers. And it also allows that employer to show their employees that if you come work for us, we have resources to help identify that. We're wanting to expand that also to the members of that household, because we know we have multi-generational families living together just to help make ends meet, and not just the employee themselves. So we're hopeful that cross-sects a lot of goals that our rural employers are seeing, and hopeful to drive down the healthcare cost. Because if we can get to these things on the front end, it's going to be less costly on the back end, that's for sure. So that's our goal there.
Well, you hit it on the head. We cannot have a strong workforce if we're not healthy. And as a county executive, whom also is a part of our economic development activities, on the scorecard of things is your health network and your access to things and your current health score data in your community. Businesses look at it, and they don't want their employees to come to a new facility that they're investing in that doesn't have access to care. And in rural Indiana, we do not have access to many services, especially OB services and some other specialized health services. So what we're trying to do is to partner with our large employers currently, and we've started programs going out on site to assist with blood pressure clinics, even blood drives. We've done some blood drives. But continuing to make sure that we have services provided to the workforce, because if they can't get to the doctor, as you mentioned, they're not going to go to work. So we're looking to bridge that gap in rural Indiana to get transportation, as well as if they don't have a provider, we're going to navigate them to one, or we're going to help them in our own office.
Yeah, a couple of quick thoughts. One is the data is really important, not only to have it, but to move the needle. Because for businesses to look at our community and say, should we locate there or not, we get spreadsheeted, right? Nobody's going in there for 6 months to Kosciuszko. I'm going to live here and just experience the community, because when they finally move and live here, they're like, this place is awesome. But they don't ever come because they spreadsheet us with data. So data, I think, is really critical for the long-term progress and every community thriving. They've got to show that things are happening. I think the other thing for me is the experience they have in the community. Does it look like, does it feel like people are thriving or living an active life? We've spent a lot of money in our grant making in building infrastructure to give every person, remove barriers and give every person an opportunity to live their healthiest life. Now, of course, that comes down to you and I making good decisions, but we want to remove those barriers, whether it's transportation, whether it's amenities or whatever. That's the quality of life play that we really feel is important. But I think I had one more point, and I think I missed it, but we're probably out of time. But economically, I think we all know that they're looking at health, and even the data that Dr. Weaver showed, we were in the 40s in a lot of key metrics. From my standpoint, the no-brainers are smoking reduction and obesity. Those are the big rocks. We know, as long as I've been in this business, the two top U.S. Killers, literally mortality, let alone morbidity, quality of life. And so that's, to me, where we should really focus, along with all the other things, but we need to hit those hard.
Excellent. Well, thank you guys so much for everything that you do in your communities. Thank you for joining us today, and we just really appreciate it. You guys humble me and how much you care about your community and the work that you do. So thank you, and thanks everybody. Appreciate it.